This video, we're going to be talking about intra-abdominal pressurization, specifically for core bracing and core stabilization. Go ahead and lie on your back with your knees bent and your feet flat on the floor. Next thing you're going to do is take a look at your ribs and make sure you don't have an excessive rib flare, okay? If you notice that your ribs are flaring, what I want you to do is see if you can pull those down, okay? You can do that by flattening your lower back to the ground, which we need to do anyways. So just take a moment to pull your lower back down towards the floor, okay? Next thing I want you to do is take a deep breath, but before doing so, put your one hand on your chest and one hand on your belly. Take a deep breath and see what you feel engaging or inflating first. Do you notice that your chest is inflating and rising first? Or do you notice that your belly is inflating first, okay? So pay attention to which one moves first and which one moves the most, okay? So some of you may look something like this. Big chest rise and hardly any diaphragm. And with those types of breathing mechanics, we'll notice a significant widening and elevation of these lower ribs. If you take a breath in and you see mostly your belly rising, that's exactly where we want to be. It's not to say that the chest can't rise. It just, we want to see mostly belly first and then a little bit through your chest, okay? So that's how we determine whether you are belly breathing or abdominally breathing or diaphragmatically, which is ideal, and whether we're breathing apically or through our chest. Breathing apically is tied to the sympathetic nervous system, and that's our fight or flight, right? So oftentimes when we're in pain, we might be fearful of something, anxious about something, or exercising, right? We're gonna breathe apically, sympathetic nervous system. That's gonna be fight and flight. Versus diaphragmatically, that is tied to your parasympathetic nervous system, which is your rest and digest. Lower heart rate, lower muscle tension, lower blood pressure, etc. So ideally, we want the diaphragmatic breathing for that reason, but also the ability and the understanding of how to use our diaphragm to stabilize our trunk and our core. So let's take our hands now, put them on these lower ribs. What I want you to do is take a deep breath in, and as you exhale, I want you to pull these lower ribs down and in, especially if you notice you've got a lot of flaring going on. So as you exhale, pull those ribs down and in. Great. Now, what you've done is you've created some tension in your belly, okay? With this tension you've created, now we're gonna train our diaphragm and we're gonna breathe into that tension that you created, okay? What this will do is increase, as you're breathing diaphragmatically, the diaphragm is descending. It's like a piston. And what it does is it pressurizes, it presses down on your abdominal contents, and it pressurizes the cylinder or tube. So, hands on the lower ribs, create some tension by pulling those muscles, those ribs in with those muscles, and then take a deep breath in. But I want you to breathe in 360 degrees, okay? Not just breathing straight up, not just breathing laterally. I want you to breathe 360 degrees. Sometimes a way that you can improve your motor control or figuring out how to do this is you just tie a resistance band around your waist, okay? You can also just use your hands, okay? So after you've dialed everything in, I'm gonna breathe in, I'm pressurizing out. Now, as you exhale, try not to let any of that outward expansion reduce or subside, okay? So I'm gonna take a 3-second breath in through my nose, using my diaphragm, breathing through my belly, and then a 6-second exhale through pursed lips, okay? So here we go. I'm gonna get everything dialed in. Hands are here for feedback. I'm gonna breathe in 3 seconds through my nose. I'm pressurizing. Now, holding this pressure, don't hold your breath. Exhale and don't let any of that pressure release. You're gonna breathe through pursed lips. Try to practice that. What you're learning is intra-abdominal pressurization for stability purposes of your lower thoracic and your lumbar spine. If you can master this, you will have your spine as stable as it can be for exercise, for walking, running, jogging, fitness, okay? So take some time, practice this. I like to do 3-second inhales through your belly, 6-second exhale through pursed lips. I would do 3 sets of 5 breaths. Give that a shot. If you have any questions, don't hesitate to reach out. Thanks for watching.